So in this model, what we have is our frontal view of the uterus. As we're looking at this, you can also see the vagina right here. So in the vagina, we currently have the sperm that are swimming up the vaginal canal and getting into the cervix. The cervix is going to be open to the vagina. This is the external os, this is the internal os. As these sperms swim through, ultimately what they're trying to do is get over into this fallopian tube, okay? So they're going to pass through the cavity within the uterus. They're bypassing all of this tissue. Remember, this is the endometrium, the myometrium, the perimetrium. They're swimming towards the fallopian tube, and as they do this, ultimately you can see right here, this sperm has met up with this secondary oocyte. This secondary oocyte came from this area right here within the ovary. So what happens is during ovulation, this secondary oocyte lived inside of this corpus luteum, which I'll show you that structure in a second. And whenever the LH peak hits around day 14, it signals that it's time for this secondary oocyte to leave the corpus luteum. That is ovulation. So the secondary oocyte will exit the ovary. It will come through this tissue. Some women actually feel this as a slight little pain or tenderness inside of their lower pelvic cavity around day 14 of their cycle. And ultimately, because these two do not touch, that means that this is all open to the pelvic cavity, which means it's not a direct route for this secondary oocyte to leave the ovary and actually get into the fallopian tube. That's why you have these structures here, the fimbria, that have these finger-like extensions, and they're trying to call the secondary oocyte over into the fallopian tube and sweep it in with that physical motion. So with this sperm penetration into the secondary oocyte, there's going to be multiple states of cleavage as this cell grows and develops and matures. And ultimately what we're going to end up with is we're going to come over here, and the goal is for this to actually implant in the superior aspect of the uterus. The reason why we want implantation to happen in the superior aspect of the uterus is because wherever implantation occurs, this is where the placenta is going to be created. If implantation occurred down here, the placenta would be created here, blocking the baby's exit once the baby was ready to actually leave out of the uterus and come through the vaginal canal in order to be born. We don't want that, because that then would impact the placenta negatively and it could cause mom to bleed out. So the goal is implantation happens in the superior aspect. This baby is going to burrow inside of mom's endometrium and ultimately tap into her blood supply. And then here in this area, what you see that we did not see on the other side is this mucus plug, because mommy is now pregnant.